Welcome to the Hank Cisco Show, ladies and gentlemen. Don't touch that dial. We have a very important show. This show is very important. It's on the headlines. It's on TV. Everybody's reading about it. Everybody's concerned about it. So we're here today. The topic today is how to stay healthy during this, I don't know if you want to call it a crisis, but it's something, a lot of bobbing and weaving going on throughout the country. So I want to thank Montgomery Hospital for having my guest today, the Montgomery County Foundation. You know, Foundation is, they do a lot of good things. So I did a good thing of getting me a doctor. And it's been tough to get a physician here because everybody's been busy, and naturally, being a TV guy, you have to bob and weave and get a hold of somebody. So I'm glad that you jumped in here both feet. And, but ladies and gentlemen, years ago, when I was a kid growing up in Norristown, and I guess throughout the country, the physicians, doctors used to come to the house, a little bag, and they would call it house call, but they don't come to your house now. You have to go to the office, you have to go to the hospital. But today, we're coming in, a doctor's call, come right into your house with information. Okay, so get on the phone, call your aunt, your uncle, your mother, good bodies, call them, tell them to get on channel 28, 28 Comcast and 48 Verizon, okay? This is a very important, and my guest today is Dr., you tell me your name.
It's Robert Solomon. Hi.
All right, okay. Tell me something about yourself.
I work at Montgomery Hospital, and my practice is called Montgomery Family Practice. I teach their family practice residents.
And you have other doctors with you?
There are 5 other doctors that are faculty, and each year we train 6 family doctors in a 3-year program, so we have 18 resident doctors at our program.
All right, and so you're here to help some ideas, right? Okay? What's going on throughout, we're talking about this, what do they call it? What kind of flu is that?
The swine flu?
Swine flu, right. One guy was saying, I think I have swine flu. So how come? He says, I'm eating like a pig. Well, that's a joke, but it's not a joke. I mean, it's very serious stuff here. So, I remember Harry Truman said, what's new? The history we haven't read, okay? Or an informed nation is a peaceful nation. An informed nation is a healthy nation. So keep it informed, okay? And education removes fear. And that's what we're doing here, ladies and gentlemen. We're trying to educate you to remove this fear, to know what to do, okay? I remember when I was a police officer, I worked the emergency wagon, we took a course on safety and first aid. And, when I get a little bit of a cut, oh, man, you panic, but educators told, look, wipe it away. You see, it's only a little bit of a cut. It's a lot of blood, but a small cut. We'll press it and stop it from bleeding, okay? So educate yourself. Now, we're going to get educated today on what to do to help ourselves and help the community, okay? Now, Doctor, number 1.
Yes.
I got a couple of questions here. I wrote them down because I want to make sure that I don't miss a thing. How can you tell the difference between a common cold and the flu?
Okay, well, the common cold occurs year-round.
All round?
Yes, year-round. And the common cold symptoms would be sniffles, sore throat, maybe a little bit of a temperature, but it's usually pretty mild, and maybe a cough.
Okay.
And the flu is different. So the flu, or influenza, happens usually in the fall, though we're dealing with swine flu now, which is something a little bit different, but we can talk about it. But the regular flu happens in the fall and winter, and the main part of that symptom-wise is real bad body aches, and a fever, and a cough, and it makes you need to go to bed. You can't function with the real flu. You're out of commission for a couple of days. It does.
You're like an Italian, you made a stonado, you're just out, right?
That's right.
That means you only hitting on a couple cylinders.
Whatever that means, it looks like that's what happens.
Yeah, that's what, that's a stonado. So, okay, but you got to be happy. You got to psych yourself up. When you don't feel good, but you got to psych yourself up. You can say, oh, I'm sick, I'm going to I can't walk. But you have to start, it's psychological too. It can help you, I know, just like I'm a boxer. I was a boxer in the ring. I mean, if I think for 1 minute that guy was going to beat me, I psych myself up in the gymnasium. I get myself medication and whatever it is to get myself in shape for the big fight. All right? Now, such as, that's seasonal, right? Influenza?
Well, influenza is usually in the winter and fall. And we're kind of over it now because it's May now, but the swine flu is a little bit different, and that's what scares people.
Now, something about your background a little bit before we go into more about these questions. So people know that, you know, we're not talking to somebody that just come out from outer space. We're talking to someone that's been around, okay? Now, you're also in the service, right? Tell me something about that.
Well,
what's your background on that?
Well, I grew up in West Philadelphia, and I went to all schools locally, and when I got into medical school, I went to Jefferson Medical College in Philadelphia.
That's top class, top shelf.
It was pretty good, yeah.
Yeah.
But pretty expensive, so my folks couldn't afford
They
to help
worked
me.
hard, right?
Well, they said, Bob, you're on your own. So
Okay.
they suggested I talk to the military recruiter, and not knowing what that was all about, I went to the recruiter, and they said, sure, we got an opening. We'll pay for your school, and you pay us back in time. So I did 7.5 years in uniform as an active duty physician, and now I've been in the reserves, and I have a total of 20 years of military service.
They call you back or anything, or what's?
I've been deployed since 2003.
Where'd you go? What they do?
I went to Fort Bragg, North Carolina, and then a couple times I went to Europe, to Germany, and I'm going back there again this summer.
Well, how about your family?
I have a wife and 3 children.
What's your wife's name?
Her name is Rosa.
Rosa. Hey, Rosa. Hey, Rosa. Okay. All right. And
I have 3 kids, and 2 of them are from Ecuador. We adopted them.
oh yeah, Ecuador.
Yeah, in
Oh.
South America. So my oldest son,
What's their name?
Well, he was given the name Diego, so he looks like a Diego.
Hey, Gumbari, right?
And then my middle son, he's not from Ecuador, is Mario.
Mario.
Yes.
Hey, that's good a Paisan name. You
And-
know. That's we're going to have Mario has a Greco-Roman restaurant. We're going to have a Italian night Friday night, and also we have a Mangiuni night. You know,
What's
Italian
a
and
what's a
Greek.
Mangiuni night?
Mangiuni in Italian means mangia. Well, I put a little switch to it. I say Mangiuni. Makes it a bunch of guys. It means a lot eat, mangia. So Mangiuni means you eat. So I don't know, just invented, So to make it a little clear, I call it the Manjun Society, So it's all Manjunis. But it's just a bunch of retired police officers, politicians, carpenters, and there's no agenda. We just eat and have a good time. But, all right, now, you work at a Montgomery Hospital,
Yes,
right?
I do.
Okay, now, how long can a virus live inside the body? Like, say how long am I expected to, I'm going to be still out for how long?
Okay, well, typically if it's influenza, which is another way, a fancy way to say the flu virus, it stays in your body for maybe about 8 days.
Oh, yeah.
So usually you're contagious a day before you get it, and then 7 days afterwards. So it's a total of about 8 days.
Yeah.
And
So-
you feel lousy for maybe 3.
Yeah. And then you start easily.
Then you
coming-
start getting a little bit better, yes.
And, but it's contagious?
It's contagious, and it's contagious through coughing. So it's in your respiratory system, your lung system. So when
comes
you
out.
cough, when you cough,
Like this?
well, to protect yourself, if you're sick, and this is year-round, has nothing to do with
Yeah.
swine
Well,
flu.
I
but-
want to learn how to bob and weave. Boop, boop. You're not going to
Right.
slip the punches.
Well, if you want to weave away from the flu,
Right.
then
That's it.
Okay.
Weave away from the flu. Here we got it now.
Okay, if
I'll
you
add
wanna-
that to my repertoire.
You can have that, that's okay. If you want to avoid the flu
Right.
from another person, if they're coughing into their hands and they want to shake your hand, that would be best to avoid that.
Yeah.
And if there's someone who's coughing, you try to stay away from them. Now, if you have the flu or a virus of any kind, it's always a good idea to cough into your sleeve
Right.
rather than your hands, because then you touch your own
Yeah,
face or
right.
touch other people. And then wash your hands frequently. That's good advice year-round for
yeah,
colds,
okay.
flus, swine
How
flu.
about
anything.
that there little stuff you push a button? It's
Well, most
what
of
do they call
the, yeah, if it's without water, as long as it's based in alcohol, which most, like Purell is a brand name,
Okay.
they're effective in preventing the flu.
That's good. Okay. All right. Okay. Now, how the best thing? Now you just said it, but just go over it again one more time about staying healthy. Now, the best thing to do is not as far as that coughing. Tell me about that.
Well, if you see someone who's coughing, then you should try to avoid them because they could potentially be carrying something that's transmitted to you.
Yeah.
So right now, with the question of swine flu, the advice is to avoid crowds because if one person's coughing, he could spread it to others.
Right.
And that's the risk in the winter and fall of influenza because people are indoors and they can cough on each other, and that's why these illnesses are spread more easily when it's cold outside.
Wait, it spreads easier when it's cold outside?
Only because people are indoors more.
Oh, okay.
So in the fall and winter, people tend to be in the house because it's cold outside and you don't spend as much time outside. And that's when there's the greatest transmission of viruses, whether it's influenza or cold virus.
And washing your hands, okay? Is there a right way, a right and a wrong way of washing your hands?
Okay, well, the traditional advice is if you're washing your hands at a sink is to take 30 seconds to wash your hands.
30 seconds.
Which is a long time. So a person told me once that if you sing happy birthday to yourself as you wipe your hands.
Let's try it. Let me see. All right, ready? 1, 2, 3. Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday, happy birthday to you. You feel better now? Yeah, good. Okay.
That was 30 seconds?
Yeah, that's enough time.
So that's a reminder, and most of the time people don't do it long enough.
Oh.
And I noticed when you washed your hands, you have to include your thumbs, Hank. So you gotta do one of these.
All right.
And also your thumbs, because that's often missed.
You know, I see that sometime when I see the doctors go to operate, they go like this, they go like this, you know. They spend so much time, you know, and then they put gloves on.
Right? That's because if there's a cut in the glove, you want to have your hands still be clean.
Oh, okay. Okay, see that? Okay. Okay, now, all right, I got another question here. How about the antibiotics, hand gel? Do they work?
As long as they're from an alcohol base, they're effective. Yes, they work.
They work?
So if you're away from a sink, it's good to wash your hands with them to keep yourself clean frequently throughout the day.
Now, we don't want to go into, you know, I don't want to do anything like the vice president scared everybody, said don't get on airplanes and don't get on subways and stuff like that. But I guess what we're saying here is protecting yourself within, you know, I guess firing range when somebody's going to cough in front of you or shake hands. So I remember in the Catholic Church, we have near the end of the Mass, they shake hands, you know. I remember one guy was going, you know, and he could have put his hand out and said, hi, you know, come on, you know, I want to go to heaven, but I don't want to go to heaven coughing, you know.
That's right.
So, all right, now, when somebody has the flu, okay, let's say, when in doubt, check it out, okay? Now, when should he or she, you know, check, go to a doctor, make a phone call? What's a good sign?
Well, there's something important to remember about the flu, whether it's swine flu or regular influenza that happens typically every year. So if you get the real flu, which is severe body aches and a fever.
Body aches.
Body
okay.
aches.
Yeah, okay.
Yes. So if you get severe body aches and a fever and a cough, if you go to the doctor and they think you have influenza, and that includes swine flu too, if you start treatment within 48 hours of the symptoms starting, you're going to get some benefit because there's a drug that you can give, an antiviral drug. That the doctor can give you if it's influenza, the real flu.
Right.
Not a cold. A cold, there's no medicine that works. But if you have the bad body aches and a fever and a cough, then you can get some treatment that works.
You know the story, they say there's no cure for a cold, so stick your head out the window and get pneumonia, and then there's a cure for pneumonia. That's
I haven't heard that, but sure.
That's what I heard. I don't know. When you're on the street, you hear all that stuff,
right.
You know. But all right, now the antibiotics. How about over-the-counter stuff? I mean, it comes in help. It's helpful, you think, or
for the flu?
Well, we're talking strictly flu now,
okay.
Right?
If we're talking the flu, the over-the-counter drugs will help the symptoms a little bit. Tylenol or acetaminophen is effective for body aches and fever. If you get the flu and you're a healthy person, you'll get over it and get well. And you don't necessarily need to see a doctor. But if there's this time of year, it's May now, and there's swine flu in your area, which there really isn't during today, which is May the 5th, there, or May the 4th.
Right, 4th.
So right now, there's not a bunch of cases in Montgomery County. There's one case.
Yeah, one, yeah.
But if say there were to be more, then that's the time when you should seek medical care because it can be transmitted in your community. That's not a factor right now.
Yeah. You remember a while back here, they had the Asian flu. Now, that was almost the same thing, or just come from another country, or come on the ships. And, you know, I worked at Sutton Ship, and these freighters used to come in with different freights and stuff, and they brought stuff in that, you know, problems. You know, I don't know if they brought diseases, whatever, you know, with all that shipment and stuff that stayed out there for years, for weeks. So all that along the coast, all that stuff that they're bringing in could create problems. They call
Well,
it
right.
Asian.
People from other countries can bring influenza to the United States, and right now the
Right
swine
now-
flu is based, it seemed to have started in Mexico.
Mexico, right. And they have, but washing your hands, now, give me one more time on that. Washing your hands and the coughing. Run that by me one more time.
Okay.
So everybody's saying, what do I do? You know,
if you wanna
while we're talking, I'll forget.
Right. If you want to prevent the flu in yourself, first of all, you should avoid someone who's actively coughing and looks sick, is sweating with a fever. That person should really stay home. So that goes for students in schools and workers in an office, someone where they're around other people. You should stay home until you're better.
Right.
So, and what you can do if you're healthy to stay healthy is frequently throughout the day wash your hands, cover your mouth when you cough, or cough into your elbow as I showed you.
Right.
And washing the hands will, even if you're exposed to the virus that causes flu, will prevent it from spreading to you.
Any symptoms of a lot of sneezing? Does that have any? I guess sneezing don't.
Sneezing by itself doesn't mean the flu.
No. Don't have anything. So
It's the body aches and the fever.
how about, okay, now we have there's no what do you call it, injection for.
For influenza, regular influenza, there is.
There is. What do they call that?
The flu shot.
Flu shot. That's it. That's what I'm trying to think. The flu shot. I get a fancy name here. The flu shot.
Right.
Now, I get that once a year. I get that from the Army hospital. But is that, what's the scoop on that now?
Well, that doesn't cover the swine flu, which is the concern right now.
Yeah. What's so different about it? What's the scoop?
Well, it's a virus, and the virus has different features to it that make it not covered by the standard vaccine we've given this year. So it's going to sneak by the vaccination and potentially make you sick, even if you got the regular flu vaccine.
Well, but it's best to get the flu shot anyhow.
Yeah,
Right?
as a general rule, there's a bunch of people that should get it every year, and it's almost becoming a universal recommendation that
right.
everyone should get it.
Right. And
The flu's pretty miserable when you get it. You want to avoid it.
well, you tell me about it. You know, I'm 85 years old, so I got the down to the dumps many times, you know. But I keep getting up, you know. All right, now, when who's the most at risk for the flu? Who do you think?
well-
elderly, young people. I see a lot of young people getting sick.
Right, well,
So there's nothing.
the very old and the very young are the ones at greatest risk of complications. So that would mean a little baby and a person, not you, of course, but someone who's older.
Older than me.
No, what I mean is a person
How
who's...
old? He's
a
St.
person who-
Patrick's Cemetery.
No, but a person who's healthy and older can fight it off a little bit than a frail elderly person.
yeah.
So if your overall health is good, you're not at greatest risk of your
don't
overall health
panic,
is
right,
lousy.
Don't panic. Now, all right, now how about that's due to the fact some students might feel a little sick or something. When in doubt, I guess they're best to stay home, right?
Well, if the person has a fever and is coughing, they should probably stay home.
Okay. Don't bring it to school.
Right, because then you spread it rapidly throughout the school or the workplace, wherever you are.
Another protection would be the mask. Now, how useful is that? I see a lot of people wearing masks.
Well, the mask is not necessarily protective because the flu virus is a certain size, and unless the mask is fitted properly and there's a certain mask, yeah, it could sneak in the side. So I think that's giving people a false sense of security.
But Well, maybe it'll scare people away. Maybe I don't know. I don't know. But I don't know. What?
It's okay to use it, but I think to assume that the mask by itself protects you from the flu is a false assumption.
Well, when I worked at the county, I was a former county detective. Then I worked safety, and I was in charge of designating spots for smoking throughout the courthouse. And so I used to wear a mask, no smoking. When the guy would be smoking, I put the mask on front and just look at him, So that's another thing, like second smoke, and that's, how it's in our system just by secondhand smoke. I mean, we're jumping from one thing to another, but it's still something that you breathe in, right?
The flu virus is something you breathe in, right?
Right. So the
You
same
inhale it.
The same thing.
Or a person coughs and it's in their saliva that drops on an object, or their hand, if they cough into it, then they shake your hand. Then you touch your face to scratch your nose. Then you can get it that way.
That carries it there.
Yes.
All right. How about taking the people have to take care of somebody that's sick? What prevention should they take?
Well, if this is with the flu, the regular influenza, if someone has the real flu, influenza, where you do a lab test.
Real influenza is dangerous, bad.
It can
Right,
be, yes.
right.
But so if you're taking care of someone who is known to have the flu, and then there was a test done that said, yes, it's the flu, whether it's swine flu or regular
right.
influenza, then you should actually take a medicine so you don't get the flu as the caretaker. But that's only a few cases. You got to be in direct contact with the person, not contact like we're having right here, where we're talking, but I mean prolonged exposure to someone who's coughing and actively sick.
How about, well, okay, now let's say, you say, well, okay, now I'm taking this medicine and I'm then looking out for everything. When do you think it's a safe time to say, all right, now I'm going to go out and enjoy myself and in company and with the crowd and all?
Well, a person is contagious for the flu 7 days after the symptoms begin. And
okay,
then
wait,
on the 8th,
that's important.
Yeah.
Let me hear that again now.
Okay.
So
if you get the flu,
I start feeling lousy, okay?
and there was a lab test that proves it's the real influenza,
Right.
then you're contagious to others by coughing for 7 days.
7 days.
So you should avoid contact with others for 7 days.
7 days. Okay. Remember that. That's, it's a good number to remember. All right. Now, what else? Now, come on. Now, get back to you now. What else? You're at Montgomery Hospital. And,
Yes.
And what all you do down there?
I teach residents how to be family doctors.
What do you mean residents?
To be a family physician is a specialty.
Yeah.
So if you want to be a specialist like a surgeon, you got to study more after medical school. If you want to be a specialist like a pediatrician, you have to do the same thing.
Okay.
If you want to be a specialist like a family doctor, which I am, you have to do 3 additional years after medical school.
Yeah.
So we teach young physicians how to be family doctors at Montgomery.
Well, is family doctor out of style or what?
I think it's in style.
Is it in style?
Yeah, it's in style.
Well, because I hear it say, well, the other guy's a specialist, the guy's this, but if nothing like a good family doctor come in, right?
Well, I might be a little biased, Hank, but I think we don't have enough family doctors.
All right, I'm with you. I remember we had Dr. Kane, Dr. Ellenberger when I was a kid, came to the house, and I had they called double pneumonia, and I survived, That used to be a crisis or something. You had to have a fever or something, and I passed through it. I don't forget that was all about having
Was
pneumonia.
it before antibiotics? Was it?
Oh yeah, all them things. We just had to. The good Lord took care of me, I guess. I don't know. All right, now, what else? Now, in Norristown. Now, Norristown is the county seat. Okay, so we have the health department. Tell me how that coordinates. How do they work? Tell me
Well,
Dr. Domino.
The health department is involved in epidemics. So right now there's a concern. There isn't an epidemic.
Okay, that's it. Let's get that.
Okay. So right now there is not an epidemic at all. In Norristown, in Pennsylvania.
Okay.
There is
good.
not.
We've got a case.
Yeah, one case right now as of today in early May. But if there were to be multiple cases, what the health department does is give advice and guidance to us as healthcare providers who give it to the general public,
Okay.
how to protect oneself and get medication for people if they're at high risk. Right now, that's not a concern as of today.
Okay. And,
But the health department is there to help out the healthcare professionals and the general community stay healthy.
now this station, my show here, will cover Conshohocken, Upper Merion, White Marsh, Norristown, East West Norton, Collegeville, the whole area here, you know.
Right.
And the people are watching. They're going to say, well, where can I get more information? Now, where can they get more information to remove that fear? You know, education removes fear. Educate yourself, and you won't be scared. You won't be, you know, you know.
Well, the best source, I have a couple websites that are helpful.
Okay.
And the website that I want people to consider visiting if they want more information is the CDC website. That stands for Centers for Disease Control.
Okay.
It's in Atlanta, Georgia, and the website is cdc.gov. And they update that daily right now to talk about influenza cases by state so that people are informed.
Yeah,
More locally, the county health department has a website as well. And that website is montcopa.org/health. So I'll spell it out. It's montcopa.org/health.
Okay. Okay. That's important, ladies and gentlemen. We're going to get that on the screen. We'll ask our director to put it on the screen. So the half hour is up. And doctor, I want to appreciate, now get a little here and say, Allah Salud means to your health, okay?
L'chaim, we say.
Allah Salud. And here's a little token of appreciation, okay? And don't forget, May the 16th, the walk for cancer, the Montgomery County Foundation, okay? I'll be out there walking with you, and away we go. Thank you.
Thank you.
All right. Woo.
Who got the pizza?